Hypothyroidism is a problem that affects 70% of people. A lot of people don't understand thyroid. Hypothyroidism is when the thyroid itself is not producing enough of the active metabolite in your body of free T3. Free T3 is so important. I explain to my patients it's like the pacer car. Nothing in the body will move any faster than the speed that that free T3 is setting up in your body. When we are 21, our free T3 is 8. Right now, most labs call normal 2.3 to 4.3. That is quite low. And I like to optimize hormones. So the higher I can keep that number, the better your body fights aging, cancer, infection, disease, and obesity. The brain has an organ called the pituitary gland. It secretes a prohormone, TSH, a thyroid stimulating hormone. That is the parameter in the blood that most doctors look at. It's unfortunate because a lot of secondary hypothyroidism is missed. So the TSH stimulates the thyroid gland where T4 sits, and that is also a prohormone. T4 is actively converted into free T3, but it cannot do it without the presence of vitamin A, vitamin D, and vitamin K2. We find that 80% of our population is vitamin D deficient. Despite our government telling us that we don't need to take multivitamins and supplements, it just truly is not the fact in today's day and age. Hyperthyroidism, on the opposite end of the spectrum, is where the thyroid is overproducing free T3. So your body is moving at the speed that is abnormally high, and it causes a lot of end organ problems. In hyperthyroidism, the patient feels initially jittery, things are happening too fast, concentration is, the whole body is just moving at a speed that interferes with normal living. Tremors, jittery, and eventually fatigued due to the body acting in that, functioning at that speed. Hypothyroidism, on the other hand, thinning hair, dry skin, dry eyes, lethargic, poor concentration, lack of energy. Most commonly, that lack of energy peaks in the late afternoon. So after getting home from work, most people just can't even lift a finger, and frequently don't even have the energy to feed themselves and to cook. So it's critical for everyone, if they're having symptoms, to have their thyroid evaluated, specifically asking for a free T3 level, and then getting on adequate medication. There are 4 medications to choose from. Nature-throid, which is natural, it is free T3 and T4. Then there is Synthroid. Synthroid is only T4 and it is synthetic. And levothyroxine is synthetic as well, and it is only T4. Nature-throid has a pureness to it. It has a 3% variance. Variance is, if I tell you the medication has 100 milligrams in it, it's going to have 97 or 103. Synthroid has a 10% variance and levothyroxine has a 30% variance. It is critical for us to use the most accurate medication with the tightest dosing so that we don't have a swing in all of those symptoms.